set aside
more that our health
technology
system
silos
focuses
to
on the
have
social
We talked about the state of healthcare. Thank you all for being here tonight. As you know, we're doing this roundtable as part of the LACMA Thought Leader Series, and the idea is to provide a forum for physicians to be able to reach out and talk to their fellow physicians. One thing I've learned as a civilian, doctors want to talk to doctors. And so this is an opportunity for all of you to reach out and talk to your fellow physicians in the Los Angeles community and speak to them about some issues of importance. So we're going to touch on a couple of topics tonight.
I'm David Azis. I'm a general ophthalmologist with subspecialties in cataract, refractive, and corneal surgery, practicing in Encino and West Hills in the San Fernando Valley since 1986.
Dr. Freeman.
Yes, I'm C. Freeman. I'm a geriatric psychiatrist. I provide psychiatric services to patients in nursing homes, as well as adult and adolescents, catering to a population that includes homelessness as well as HIV.
Dr. Kurian.
My name is Sarah Kurian, and I am a preventive medicine and public health physician, and also I'm currently the Deputy Medical Director for the LA County Department of Public Health. I've been with the county for about 8 years, and in addition to doing administrative work, I also do some clinical work in our TB clinic in Antelope Valley.
Dr. Kraus.
I'm Howard Kraus. I'm in the private practice of neuro-ophthalmology in West Los Angeles since 1984. And I think it would be appropriate to acknowledge that all of our panelists this evening have also been very active in LACMA and CMA, with Dr. Azis, soon to be a president of the California Medical Association, and Dr. Freeman having served LACMA and other organizations for many years. I'm a past president of the California Academy of Eye Physicians and Surgeons as well as LACMA, but my present main assignment in the healthcare arena, other than caring for my patients, is as a member of the Medical Board of California.
Dr. Shiba.
Hi, I'm Diana Shiba, and I'm also a general ophthalmologist like Dr. Azis. I spend 50% of my time in clinic up in Antelope Valley and 50% in an administrative role as the Director of Government Relations for Southern California Permanente Medical Group.
Dr. Russo.
I'm Frederick Rousseau and a general internist by training. I'm currently the president CEO of Facey Medical Group, which is a multi-specialty group predominantly in the San Fernando and Santa Cruz Valley, and I've been around since 1984 and a member of LACMA and CMA since that time.
Can you give us some view from your perspective on the state of healthcare and also the state of medicine as opposed to healthcare as a whole?
We know what we experience in our own lives, our own practices, our own communities, and we're greatly influenced by what we read in the papers and watch on television. So I'm one who always accepts that we can do better, but perhaps it's not as bad as people say it is. And I start with the basics. And just as I truly believe that we as a society have obligations not only to ourselves and our families and our communities, but to our society at large, I think we need to accept that just as we don't wish for people to be malnourished and we don't wish for people to be homeless, we don't wish for people to have no access to health care. So probably the number one problem that remains in the United States, despite the efforts of the Affordable Care Act, is that there still are many people with inadequate access to health care. There are perhaps 16 million more people with some health insurance today than there were in 2008. But having health insurance or having Medicaid doesn't necessarily assure that one has access to health care. And I think that's a problem that needs to be solved. Hopefully, we'll work toward that goal. We each have different opinions as to how to get there, but none of us have the ability to push the levers. We stand by and watch what government does, both at the federal and the state level, and we stand by and watch what the health insurance companies do and the health plans do. But one of the things that I admire about my colleagues is they're not just sitting in their offices taking care of patients, they're actively engaged in trying to create a better healthcare milieu for society. So I commend my colleagues for being very active in their medical associations, for being leaders in their medical associations, for taking the time to meet with legislators, to visit our state legislator, to visit federal legislators, both in DC and locally, because unless we physicians who know what it's like on the front lines of healthcare participate in the process, I suspect we'll end up someplace worse than we would otherwise. So I'd like to see improved access to a high quality of health care for all Americans. I'm happy to be one of many participants in guiding us there, but none of us individually can design the program. We have to work together.
Dr. Freeman, on the state of health care?
Oh, wow.
Easy questions, Doctor.
Yeah. Not really sure I stand in a position to give a global perspective, but I can certainly give a perspective to the population which I serve. And one of the things Dr. Kraus mentioned had to do with access to care. And unfortunately, many people believe because the ACA exists that all of a sudden people have access to care. There are many people who still do not have insurance. There are many people who, even if they have insurance, don't really know how to maneuver in a very complicated healthcare system. And so even though we have made many advances in terms of affordability of health care, in terms of the research and the quality of health services that we can provide, there is still a very large population that does not have access, and even if they do have access, they don't know how to maneuver in that system.
Okay, thank you. Dr. Jesus.
I would characterize the state of the healthcare system presently as one of uncertainty and turbulence. The uncertainty has been created by the change in the administration in Washington, D.C., and the desire of the Republicans to repeal the ACA with no replacement in place. And the turbulence is created within every state in the country that is dependent upon significant funding for their Medicaid population through the ACA that now is threatened with being terminated. So in California, we receive about roughly $20 billion as a result of the ACA to help care for our Medicaid population, Medi-Cal in California, and there's a great deal of uncertainty on whether that funding is going to continue. In fact, the governor is going to be introducing his budget this week, and it is expected that in that budget he is going to take the tax dollars that were created by the initiatives that were passed in November in the state to improve Medi-Cal funding and Medi-Cal access, to use that money to provide a basic level of services in the event that the funding from the ACA is reduced, and which is what we expect to occur. So we're in a very difficult time right now. We don't really know how to prepare, and the uncertainty that creates both for the patients and the physicians is extraordinarily difficult to deal with.
Dr. Shiba.
So I would echo the concern for the public on access to affordable, high-quality care. I, have personal friends. I know a husband who benefited, was able to get hip surgery that he'd been waiting for years and years and years, and now can walk and run and go on hikes with his wife again. So I think I only echo the concern that I hope with the changes that are likely to come in the future, that our patients, you know, the people that I know, continue to have that kind of life-changing care. ACA brought some great changes to a lot of patients' lives, and I just hope that we do continue to have that kind of coverage for patients.
Thank you. Dr. Russo?
I'm concerned about the lack of access to care for patients in the Medi-Cal program in terms of being able to get access to specialists. Whereas many of the, it's my understanding that many of the patients that prior to the ACA were being moved into Medi-Cal HMOs were basically going to be able to have at least some access to primary care, but I don't think there was enough funding to attract enough specialists to be able to provide that, and that really puts the primary care physician in a very difficult situation in terms of being able to follow through with the care that's needed. Now, when you add another 5 or 6 million patients that ended up on the Medi-Cal rolls post-ACA, with not a lot of, well, there was some additional funding. Mostly it was an incentive to get people to join in, predominantly primary care physicians, and then that was supposed to have gone away. But it didn't really do anything to encourage specialists to be available. And that's a key part of the delivery of care. And I say that as a prior primary care physician who would need to, you know, benefited from having a relatively deep bench of specialists in my particular practice setting. So I think that needs to be figured out, and to hear Dr. Azus talk about the fact that we may lose federal dollars, and what we achieved with the initiatives of 55 and 56 to try to, you know, put another $3 to $5 billion on the table to help that. That's very discouraging if, in fact, the new administration is going to rip that asunder. So I'm less concerned in the healthcare market for those who are insured with employer-based insurance, because I think those insurances are very reasonable, and people start to realize that when they lose that. And I think that a number of people, at least from what I hear tell from a GI specialist I know, seem to indicate that a lot of his patients are bemoaning the fact that they lost what they had only to get Obamacare, the ACA, and that did not provide them nearly the coverage that they needed. When you understand that, or as I understand, I should say, that the deductibles are quite substantial, except for preventative care. Fortunately, they can get preventative care, but if you've got a medical problem, you've got, you know, $5,000 or $6,000 deductible. That's not like having a lot of insurance when you're living on the streets or you don't have a lot of margin. So I'm not sure how much insurance they really have, at least on the front end, until they exhaust that deductible. Perhaps Dr. Freeman has a better idea about how that actually works out in practice in the trenches. But so I think that we've gotten some comfort with having the ACA there and having people on rolls, but I worry about the true access to care. And if the Republicans can do anything to reform that part of the problem, I think it will be, I'll feel a lot better in another couple of years. I'm not sure they can do that, and the issue of replacing it with something that's not in place is a very scary thought. It's got to be a very scary thought for a lot of patients out there, and for those health systems and even individual physicians who have signed on to the ACA. If that gets pulled away, then that's going to also hurt their revenue stream and their ability to continue practicing when they've made the noble jump to sign on to that. So those are, I guess, the tip of the iceberg of my concerns that I can give you right now.
Thank you. We're going to come back to access to care in a moment, but we haven't heard yet from Dr. Kurian. Dr. Kurian?
Sure. Actually, I think I can echo what a lot of you guys are saying here in terms of access to care. I think from the standpoint of the Department of Public Health, access to care is a concern. We've seen a huge increase in the number of people who've been able to access care, but again, the quality of that care and the extent of the care is definitely under question. But for us, it was sort of an opportunity for us to move away from direct service provision and turn to a role of a health strategist, which now, if even this limited or maybe not so perfect access to care is taken away, I wonder about our ability to really divorce ourselves from primary clinical provision and focus on things like health strategy for the county and for all of those people who may already have insurance but have specific issues and needs that need to be addressed as well. But beyond access to care, the department, I think, is looking at a variety of different issues. And in terms of the state of health for LA County, one of the interesting things we've seen is we've made huge advances in terms of the leading causes of mortality, and we've seen trends, decreasing across, all of the primary reasons that account for mortality, like, cardiovascular disease and COPD. But nationally, the interesting thing is we've seen a slight uptick in mortality rates, and that seems to be mirrored in LA County as well. So again, our ability to work as a health strategist to really identify why this issue is happening and to collaborate with other partners to address these issues is a big concern for us. In terms of funding, the 21st Century Cures Bill was signed off by the last administration, which is a huge boon in a lot of different respects. But one of the concerns is that it does take about $3.1 billion away from preventive and public health issues. So as a department, we're sort of wondering what this is going to mean in terms of public health and preventive services in the future. So there are concerns across the board in terms of the future of and the status of health for LA County.